Branya here with Cashers Valley Fusion. Today I am with Dr. Resa Johnson of Cashers Chiropractic and Wellness, which is just across the street from my studio. And today I want to just learn a little bit more about Dr. Resa, what she does, what she offers, and in my opinion, the benefit that she is offering to our community. So with that, can you tell me a little bit more about yourself and how you came to be in the practice of wellness and chiropractic care?
Well, since this is my most favorite topic, but first of all, I'd like to say thank you, and thank you for the opportunity to do this and connect. I am a believer that there are many things that are important for health, and yoga has been a staple in my life since I've been 20 years old. For me, it keeps me feeling youthful, it keeps me feeling agile. It is just something that I intend to do at minimum of twice a week till the end of my days. I grew up, I'm a chiropractic physician, I'm a diplomat in clinical nutrition, and I practice functional medicine. So I was born into a chiropractic family, so my young life was very natural and nutritious and organic, really very organic. No medicines.
Like that?
No medicines, yeah. And so when I got married, and I met a wonderful person in chiropractic college who we became husband and wife, and it was really a wonderful way to have a family, because even though he came from a medical background, much more medical, we kind of, as time went on, kind of found our groove and our path, and were able to have our 3 children. We had our 3 children at home with a midwife, and were raised on foods and vitamins and homeopathics. And actually, you might not know this, but my son started the company Genexa, so they're very much involved in a genetic non-GMO formulas, and they're actually going to be formulating over-the-counter products that are non-toxic.
Awesome.
So it's about non-toxic, and what
in
do
the
we
toxic world we live in, that's extremely important.
Right. And so it's not our biological age, it's how we feel. And so functional medicine is about what causes the issues that we're experiencing. And as with yoga, it goes hand in hand with mind and body, and and spirit. So with chiropractic, I have, over my career, included everything into a wellness program, and also refer to experts in the field. It takes, a village, and it's a village of physicians and practitioners, and not the same type of treatment for one patient will work for another. We're all very individualistic, and I think that's really important as a physician to know that. It's not going to be the same treatment for each person.
Now, in addition to the functional medicine and the chiropractic care, what else do you do? What are your specialties? How do those different facets of your practice work together to benefit patients?
Okay, so about 20 years ago, I started doing medical detoxes. And these are programs that I feel, in a very short period of time, are an extremely powerful way for a person to experience an improvement in their health. And so I've incorporated that 12 years in our practice in Nashville, in spring and in the fall, and we intend to do a few up here in Cashers. So that is a way to really, in a very short period of time, create a huge shift in someone's health, and have them see how things and habits that we get stuck on, that become like drugs. Sugar can be a drug,
Right.
caffeine can be a drug. So it's a very short time you can really see a significant change in body composition, and a lot of people want to lose weight, and that's not the reason that I encourage it, but it's a way for many to expedite weight loss and cleansing, and then to stick to the path.
Nice.
Exercise, yoga, sleep habits
Right.
are huge. The way we drive in a car, our emotional well-being, and optimism, or the way we look at the life, a glass half empty or glass,
That's
half
right.
full.
That's right.
So,
Okay. Well, as we enter the fall season, it never fails. I always have folks at the studio, or friends of mine, or associates in the real estate side of my life ask me questions about cleansing and detoxing, and is this the right time of year? And there's a slew of detoxes out there in the world, and I'd love for you to kind of touch on, first of all, you mentioned doing these detoxes in the spring and in the fall, so if you would kind of share with everyone the reasons for those times of the year, and kind of expand on the detox program that you're working with, that you're putting out, and why.
sure. There are a lot of detoxes out there right now, a tremendous amount. What I do is a medical detox. Our program is three phases. First is the preparation phase, or a modified elimination diet, where you go off of the foods that are addictive, the foods that are challenging, the foods that we have sensitivities to. So, many people are aware of the sensitivities of dairy and gluten, and the addiction of sugar and the alcohol and caffeine. So we go off of these drugs, food drugs, bad oils, trans fats, and we give people time to kind of get used to that, which is the first 2 weeks. The second week is the detoxification. So what we want to do is the liver is a huge detoxification organ, and it's an organ of energy. Okay, so with that, we want to be able to cleanse the body. It's going to affect cholesterol, it's going to affect fatigue, it's going to affect the way we sleep, it's going to affect, I think I said cholesterol, but not triglycerides, blood sugar. I have patients that are able to go off of blood pressure medication because after they do the program, their blood pressure is maintained. And I work with their medical doctors, and they're watched, and I can't tell you how many people have gone off of many kinds of drugs. Sometimes people go off of Tylenols and allergy drugs.
Right.
As a matter of fact, there's a yoga teacher in Asheville who no longer has to take allergy medicine.
Wow.
So
That's interesting to me, because I am a huge allergy sufferer, and anything that takes me down the path of potentially getting rid of that appeals to me, because it's a suffering.
Right, it is a suffering, and digestive issues. Detoxification is a wonderful, wonderful program, and sometimes I focus the detox on different areas of wellness, but the main focus is on liver detoxification and cleansing and balancing of blood sugar, because diet is so much of a problem with chronic diseases such as diabetes and heart disease.
Absolutely.
And they're even saying that Alzheimer's now is, the next chronic disease that's developing from diet. I think there's other reasons, but I think there's a piece of it there with blood sugar. So you asked me, the spring and the fall
Yes.
are wonderful times to do a detox because of the way we as human beings act during the times of the year. Right. So I always finish the fall detox before Thanksgiving. Always before Thanksgiving, because Thanksgiving to Christmas is a time for family. There's a lot of food traditions, and we don't want to be struggling with that.
Right.
But if you do the detox before you get into Thanksgiving, your self-control or your awareness or your consciousness about what you want to maintain with your health is is so much
It's
more.
almost like a reset button,
Yes,
maybe?
it is a reset button.
Right?
Yeah.
Yeah.
And that's something that's a term that I have started using because so many of my clients redo the detox sometimes twice a year, but if not twice a year, then yearly.
Mm-hmm.
And I looked at it and I said, gee, I was looking at all these young patients who were doing the detox like every time, and I said, you know what? It is a reset.
Mm-hmm.
Because each detox is different. When you first start, especially if you haven't had real awareness of what healthy eating is, it's very complicated and challenging sometimes for people.
This is very true.
So we take it really slow, and whatever that detox is, it's perfect.
And
just like in
intimidating.
yoga.
I think
It's
just like in yoga, some people are afraid to step into a studio because they're intimidated. They feel out of place. It's not their home, so to speak. And I think the same is probably true when it comes to changing your food habits
Right.
and or identifying where you may be overindulging or the things that you love may not make you feel good, and that's a mental and emotional piece as well that goes along with that. So
And you learn so much about yourself.
mhm.
And each detox could be different things. One could be energy. One time it could be sleep. One time it could be, and sleep is so important because people today are having challenges with sleep.
Mhm.
So it could be sleep. It could be weight. It could be mental fog.
Right.
So many people have this like lack of clarity and mental focus
Right.
that changes when they do a detox. So the spring, usually the spring, people are just getting geared to wear less clothing. And
Yes,
it's
I love
usually
the
that's
spring.
the motivating
Love the
factor.
spring.
But it's such a wonderful time
Right.
to just really brighten your life and brighten your health.
Nice.
Yeah.
So, can you tell us, I think you had mentioned briefly that you have a fall detox group program coming up. Can you tell us more about that?
Okay, so I am recently back in practice in Cashers, and
Welcome back.
thank you. And it is something I have done detoxes here before, but I thought this would be a really wonderful way. First of all, I thought it was really wonderful that we would co-create with this, and
Mhm.
that we would actually do yoga for detoxification.
Mhm.
Okay, and I like to work with other healthcare professionals. In Asheville, I do work with yoga and the medical profession, because, like I said, there are people who are on drugs that sometimes need to come up or
Right.
lower their medications. But I think I just lost track.
It's okay.
So why? Thank you. So why did I decide to do this? Because I really want the clinic to have an integrative approach. And some people aren't aware of that within the office.
Right.
We do have a massage therapist. We do have a naturopath who's doing incredible work.
Incredible.
Thank
I'm seeing
you.
her and I love her.
Thank you. Dr. Monica has really, really been well received and is doing wonderful work.
Mhm.
So I talked to the staff, and the staff is really behind it because it's been a number of years. And we feel that the Cashers community is really interested and ready for something like
I
this.
agree.
Yeah.
I agree, absolutely.
Yeah.
Well, let's see. I will have more information about the detox coming up in October. I believe it's
The
October
15th.
15th,
Yeah.
right? October 15th. And there are 2 weeks where you kind of start eliminating things little by little, and there's an ease in process and an ease out process.
Exactly.
But there's 1 week of time that it's the real deal.
It's the real deal.
You're going to have to really commit, be serious about it, and give yourself that opportunity. So I will post more information about how you can participate, the details about the program itself, cost, etc. And if you have any questions, you can certainly reach out to me, and I will also provide Dr. Resa Johnson's information. So thank you for listening. Thank you for your
Thank you.
time.
Thank you.
And take care.